Good evening, everyone. My name is Stephanie Coleman. I am the Autism Family Educator here at Kansas Lend at the University of Kansas Medical Center. If you have not been with us before or don't know, LEND stands for Leadership Education and Neurodevelopmental and Related Disabilities, hence the word LEND to make it easier. We are a workforce training grant that is funded by the Maternal Child Health Bureau. We train graduate level students and bring in the lens of lived experience from family members and individuals with intellectual and developmental disabilities so that we can train graduate level students and medical students on how to best support individuals and their families that have intellectual and developmental disabilities. So thank you for joining us tonight. And tonight we are going to be talking about passports. I'm really extremely excited about this because I think that these passports, and you'll learn that they are going to make life a little easier when you're thinking about dental appointments and doctor appointments, if you get these completed ahead of time. So I hope that you'll share with other families, and if you are a care coordinator or case manager watching this, please share with your clients this information as well. So first up, we are going to hear from MaryAnne Lynch Small from Oral Health Kansas on the My Dental Care Passport. So take it away, MaryAnne.
Thank you. Thanks, Stephanie, and thanks for having me. As Stephanie said, I'm MaryAnne Lynch Small, and I'm a dentist, and I work with Oral Health Kansas. So we're all about healthy teeth and mouths. We raise awareness about oral health, educate people about different aspects of oral health, like how to care for your teeth, and then we also advocate for better oral health for all members of our communities. I wanted to start just with this question here. So why does oral health matter? Our oral health is really, really important for us to be able to live our life to the fullest. Unfortunately, it doesn't always get the attention it deserves, our oral health, and that's sometimes why there's not that awareness and education just about how important it is, and sometimes why there's difficulties accessing dental care and dental care that's appropriate and affordable. So poor oral health can mean an increase in dental diseases, so things like dental decay and cavities and severe gum disease that can result in pain and infection, and also increase your risk of other diseases like heart disease, diabetes, and lung infections. We also find that poor oral health and having some dental diseases can make it harder to do things like eat and sleep and smile and socialize and communicate, which can affect our overall quality of life and things like our self-esteem and our mental health. Unfortunately, if we look at everyone in the country, individuals with intellectual and developmental disabilities and autism have higher levels of dental disease and often have a harder time finding a dentist than people without IDD and autism. So that's why we started something called Pathways to Oral Health. So Pathways to Oral Health is all about improving the oral health for and the dental care for people with disabilities. There's lots of different people involved. Stephanie's involved, and there's individuals with IDD, families, caregivers. We've got dentists involved, the dental insurance, the Medicaid managed care organizations, community disability organizations, and I'm going to miss a few because there's more. And we like to talk about us having kind of three buckets of work. The first one is, can we get more dentists to see people with disabilities and also to accept different insurance types, things like Medicaid? The second is education, so learning how to best take care of your teeth and mouth at home. And then the third is communication, so improving how we communicate and get across our unique needs to the dentist and the team at the dental office. So that's everyone you meet at the dental office, from reception desk to dental assistants to the dentist to the dental hygienists. So we can help make you live healthier and kind of more confident lives. And that's why we're here today, to learn about a tool that can help with communication and make dental care a bit easier. So that tool is called My Dental Care Passport, and it is a document designed to make the communication of important information about you and your story and your dental experiences as easy as possible, and then be able to share that information with your dental team before you even go into the dental office. I guess in terms of the story of My Dental Care Passport, and I think it'll link quite nicely with the next part of this talk. It was actually based on a similar document called a medical passport, which Skylar, a young man with IDD, and his mum Tammy had come across during medical visits. And they thought this could be a really useful tool if we designed a version of this for visiting the dentist. And particularly because Skylar at the time was trying to find a new dentist in a new city. So together with the team at Oral Health Kansas, they designed the first version of My Dental Care Passport, and it allowed Skylar to tell his story and share his needs with his dental team. And it worked really well. Skylar and his new dentist loved it, and really helped him form a bond with his new dental office. So kind of sharing this information helps you share what you think is important for your dentist to know. It helps the dentist know you a bit more as a person, and that helps make your visit to the dentist really positive and successful. So we'll see if this works if technology allows us, but I'm going to play a little video here just to let you learn a little bit more about the passport, and then I'll kind of show you a few highlights. So let's see if it'll work for us.
MaryAnne, I'm not hearing sound.
So I can send you the video as well, so you can pop that wherever you want it to be. There's also some subtitles along the bottom, so I'll share a link to the video.
Okay.
Excellent. Well, so I told you a little bit about how the passport started, and we're actually updating it right now. So it's under construction. It's getting a new look, and just to make it the best possible version of the tool it can be. So I'm actually going to give you some kind of previews essentially of the new passport, and show you kind of give you an idea of the sorts of prompts in there, so you can see it's not just like a typical medical history form. It really is a you and your story and your dental journey form, and then go over a little bit of how to use it. So here is the passport here. We want to make sure that it's really clear, accessible, and easy to use. So the passport can be filled out online, or it can be printed and completed manually. And we've also designed it to be able to be used with an e-reader. And it's also available in Spanish, and we're hoping to add more languages later this year as well. Again, we always like to highlight this bit right at the top of the passport here, that the passport is unique to you, and it's up to you what information you want to share with your dental team. So you can really choose which prompts and which questions speak to you and are really important and relevant for you. So the passport will prompt you to think about what can really help make your visit to the dentist great for you and great for the dental team. So things like this question at the top: what was your best visit to a dental office, and what worked well about that visit? And then also, if you had a visit that didn't go so well, what things didn't work well. And this can help you and the dentist learn from what's happened in the past, and help anticipate and kind of prepare for upcoming visits as well. It's also important to let the dentist and the dental team know how you best communicate. So things like making sure that they give you enough time, or that they're talking directly to you if that's what you prefer, and whether you might use some communication devices or aids, or prefer communicating and learning through pictures, for example. So knowing things like this in advance can help the dental office be prepared for your visit. And it also means that you don't need to tell your story every time you come in. They already have the information that you wanted to share with them right there in the passport. And the dental office can be a really cool place to visit. I might be biased there, but there are things that can make it even better for you if you let the office know your kind of likes and dislikes. So maybe you prefer to have some of the lights dimmed, or maybe you'd like to bring something like a fidget spinner into your appointment. Or maybe, and this is like me, that you're just really interested in what the dentist is doing and you want to see the mirror that they use before they use it to look at your teeth. So now you've seen kind of some bits of the passport. How do you use it? So we've created a handy guide here to really help you make the most of the passport. It's got some instructions on how to use the passport and explains a bit about how it can improve your visit to the dentist. Again, we want to see this bit of when you use it, that it's really most useful if you can fill it out and send it to the dental office before the day of your visit. And this gives the dental team some time to learn about you and make any changes that they might want to make to make the visit as best as it can be, and add the passport to your records. It means that they know that this passport is attached to you when you come in. Again, there's different ways that people want kind of send it to their dental office, and you can discuss with your dental office and see what works best for you. Some people like it by email, some like it in the mail, some people you can even go and hand it in beforehand. It's up to you and your dental office how you want to do that. Again, as we were saying, you only fill in what you feel comfortable sharing, and this information is only available for that dental office team. It won't be shared with anyone else, including other healthcare providers, without your permission. If you then were going to see another dentist or another, say a doctor, and you wanted it to be shared, you can say, yes, you can share it, but it won't be shared without your permission. As I was saying, you can complete the passport online, or you can print it and fill it out by hand. And sometimes you might need help from a family member or a caregiver to complete some parts of the passport. And it will take a little bit of time to fill out. But what we hope is that although you spend a bit of time filling out the passport, it will save you time later on when you go for your dental visit, and means that you don't need to tell your story again and again. The dentist will already know a bit about you. So where do you find it? So we've tried to keep things as easy as possible, and we've kept all these bits together. So there's a website here that's www.oralhealthkansas.org/dental passport. And there you'll find the dental passport itself in English and in Spanish. We've got the help sheet for you. There's also a help sheet for your dentist. If you want to direct your dentist to that, it just helps the dental team know how to use the passport. And there's also that video, so you can go in and have a look at that video. And please feel free to share my dental care passport with others, and you can share the video if you'd like. You can use it on social media, newsletters, websites, wherever you think it would be useful.
Yes, I've added the two links, the link to what you just shared in the chat, and also the link to the passport. If you are watching this later in a video session, the links will be in the description of the video. So look there for that information.
Awesome. Thanks, Stephanie.
Yeah.
Again, we've got lots of more helpful information about some of those pieces that I was talking about at the start, kind of education and things like that on our website. So there is a link to the website there as well. And then if you think, you're watching this after and think, oh wait, I've got a question I want to ask, I've put my email there as well in case you want to reach out to me directly and ask me any questions about the passport or any questions about the Pathways to Oral Health project. We're happy to answer any questions you might have. So thank you very much for having us.
Yeah, thanks for sharing that. I want individuals to know Oral Health Kansas is currently doing a fantastic job advocating for individuals with intellectual and developmental disabilities throughout the state of Kansas. For those of you who may not know, when our children grow up, they don't lose their disabilities. They don't all of a sudden not be disabled. And they're on Medicaid. And most dentists currently do not accept Medicaid because the reimbursement rates are so low. So for a lot of us, I have an adult son, a lot of us, it's really hard to find a dentist that will take Medicaid and support our adult children. And Oral Health Kansas has been working really hard and advocating in Topeka and with legislators to increase that reimbursement rate so that it will be more acceptable to dentists and they'll start considering taking Medicaid. So we're
Yeah,
really,
fingers crossed.
yes, as of February 6, 2025, they have talked about increasing that rate. So thank you to all the people at Oral Health Kansas for doing that. So
Over the first hurdle, so we'll see what the next committee says. So fingers crossed, everyone.
that's it. So I don't know if anyone else has any questions. But we will turn this over to Stephanie Pratt. Stephanie is at Children's Mercy. She is a social worker there. I don't want to exactly say everything, so I'll let her introduce herself. But they also do a lot to support kiddos with intellectual and developmental disabilities. And I feel like the passport that they've helped develop there is really important too. When your child is sick or has an emergency or even just everyday doctor visit, you go and, I don't know how many times I left and go, oh, I wish I had shared this with them, the doctor, or that with them. And so these passports give you really a lot of time leading up to your visits to update and fill out all that information so that doctors can spend that time ahead of time getting to know our children versus, and I hope I'm not stealing all your thunder, Stephanie, and what you
No,
were going to
please
share,
talk.
but
We all
um,
kind of are on the same team.
but they'll take that time and actually get to spend time with the children or with the dentist or whatever. So now I'm going to turn it over to Stephanie Pratt.
Oh, perfect. Well, my name is Stephanie Pratt. I'm the Transition to Adulthood Program Manager at Children's Mercy, and I'm a social worker by background. And really what we focus on is preparing young adults and families to leave the pediatric hospital. So, we have this safety, happy knit of pediatric care. And unfortunately, everyone ages out. Everyone grows up, they have to leave, and we don't have a adult hospital down the hall that we can send our kids to. We have to prepare them to access care in the adult setting. And as everyone knows exactly where we're located, some of our families are on the Missouri side, some are on the Kansas side. And so there's just a lot of coordination that we have to do to kind of prepare them. And one of those things that we've done is kind of the idea of creating a health passport. I'm going to share my slides right now, and then I will. Okay. Can you guys see that okay?
I do not see anything yet.
All right, let's see here. How about now?
Not yet.
Well, it's sharing. Oh, I need to. Goodness gracious. Sorry. We have
That's
everything
okay.
on Teams, and so
Technology. There we go. We're
you got
starting
it?
to see sharing screen. There they are.
Okay, perfect.
Great.
Love it. Okay. And so a lot of the passports I'm going to be sharing with you today is one we use across the organization for all of our teams. So we add some things in additional to for our patients with IDD and special healthcare needs when we're talking about how we ask questions and what we share. But really the first part is just that core information, because I always tell parents to think about that even if your kid is going to a day program, or a residential care facility, they might be taken to an urgent care. They might see a provider that doesn't know their history. And we want to make sure that we can communicate all those important pieces and those important elements of their care with them. And then some of our kids are going to be off on their own, doing their own things. And we want to make sure we have all that information kind of at their fingertips. And so I know we've already kind of touched base on this, but really Health Passport is just how we communicate our medical history, our personal history, our way we communicate with each other, and what we feel is important and what we've personally been through. It can sometimes, and as people know, it can be traumatic to talk about our history, especially with medical care. It can be traumatic to talk about a procedure you've had or something. And so if we can share this in this way, it might be easier on families to kind of share what they've gone through. And it's really important for patients and caregivers, and also for providers, to have a full history, a picture of what's gone on for you. And then really, what does it do, especially for our transition-aged youth? It improves patient safety because we're sharing our information and our history. It improves communication. It helps us understand decision-making models. So if this patient has a guardian, we're able to identify that. If they have supported decision-making, if they're their own decision maker, those are all really important things for people to know. And it gives us quick access to basic health information. Now, this isn't going to be your full medical history. This isn't going to have all of your surgical history and all of those, but it's going to have the highlights and those things that are kind of most prevalent in your care. And so I'm going to go into, so this is kind of the top part of our health passport. And we can do this, we typically do this per specialty. So for like cardiology, for neurology, for primary care, we can do it overall, but we find that kind of to be helpful. And so we'll kind of say, where is this from? Is this your cardiology health passport? Or what diagnosis are really focusing in on this information? And then we really have those basic core information like name, phone number, insurance, date of birth. Who's your primary care provider? That's a big one that a lot of teenagers don't know. What pharmacy do you use? Who's your emergency contact? And do you have a guardian? We kind of think of those as kind of our core demographic information pieces. And really, these are the main contacts that are supporting their health. And this is the piece, this little 2 screens, these are our family's favorite pieces of our health passport. And so this whole passport is a PDF and it's fillable. So you can put all your information and save it. And so what we can do, these are drag and drop image boxes. And so patients can pull in images that are relevant to their care. So if someone has a cardiac history, we can pull in their most recent EKG. If someone has a tracheostomy, we can put a picture of their trach size or their suction depth. Or if someone has a prosthesis, we want to have the information on that. Really, whatever it is, whatever is prevalent to their care, that is important for the people looking at this passport to know. And then we can also pull in test results. So do you have diabetes? And what's your recent blood sugars? What's your standard sugars? Or, really whatever diagnosis tests that are beneficial to you. What's your baseline oxygen? That's one that it's not the same for everybody. Kind of whatever those test results are that patients feel is helpful for someone to know that doesn't necessarily know their history. And sometimes this gives people a sense of comfort to know that this information is here that anyone can access. And then this is kind of our second piece of the passport that we have. And it really just, again, continues to go over those demographic information. So what are your allergies? What medications are you taking? What medical devices do you have? Do you have a G-tube? Do you have a pacemaker? Do you have, a hip replacement? Whatever it is, do you have a port? What are those medical devices you currently have within yourself? What's your durable medical equipment company? What DME do you have? Do you have a ventilator? Do you have a suction machine? Do you have a feeding pump? Are there any other diagnosis related labs that we've taken? Are you on oxygen? What is that baseline NO2? Do you have any activity restrictions? Are you able to walk a mile? Or are you able to lift things? What are those physical restrictions you might have on activity? For our teenagers, do you have any pregnancy considerations? Now, again, we use this passport for all of our patients, so some of these don't always apply to everybody, but are there any reasons why you shouldn't be getting pregnant? Are you on a medication that doesn't go well with that? Are you currently on contraception? Are there any big previous tests and procedures that have been really prevalent in your history? And what kind of follow-up appointments do we have coming up, just so they know the kind of who you're engaged with? Um, and so those are kind of the core elements that we have in our passport. In a minute, I'm going to go into the additions that we have for really our IDD patients. But so the benefits of how this is used is we do it in clinic with our patients, either before they transition to a new clinic. So like from patients going from our infant home vet clinic to our pediatric home vet clinic, or if they're leaving the orthopedic clinic and going back to their primary care provider. And then we also use it at their last pediatric visit. So we're sending them off into adult care with a completed health passport. We do this in conjunction with a medical summary because this information alone isn't enough, but we give it to them in a PDF format that they always have at their fingertips. So if you're running your kid to urgent care, you don't have time to download the years of medical records on the patient portal or things. You have this information. Or if you have a nurse that's taking care of your child while you're at work, or you have your child's going to a day program or things, these are information that you can give to them and feel confident in the people kind of providing that care for them while you're gone for the day. And this can be updated. This is a growing document. So we might send patients out into adult care with this document, and then their PCP can add things to it. The patients can grow it. You can update things. And again, this is a PDF. So this is not anything that we own. We're giving it to the families, and they can continue to update it as they feel the need. And again, that version I just shared with you is primarily focused on our young adult and adolescents that can participate in some way, that they can understand what we're talking about. But we have a lot of patients that are seen in our DMB clinic with our autism patients where it's important for them to be able to know some of this too, and to be able to provide to the people providing their care. And so in addition to this, the things we've also added into it for our patients with IDD, I feel like are really important because it goes beyond just the health situation, the health questions, that core medical health passport, those stay the same. But then we're also asking information is like, what do I prefer to be called? Who do you contact if I get admitted to the hospital? Who is that person, that core person that knows all of those things about me? Who can make my medical decision? So that goes along with having the guardian information on there. And then what are important things to know about me? What do I like? What do I dislike? How do I communicate? Do we need to pull in a picture of your communication device? Or do you have sensory issues? And then also talking about the things that cause me stress. So is it bright lights? Is it loud noises? Is it texture, sensory? Do I really hate shots, or do I really hate the blood pressure cuff? Like, what are all those things that help me to provide your care in a better way? And what are my special interests? If I'm really upset, do I like to have music on? Or do I like something that smells like lavender? Or do I like bluey? I mean, like whatever it is, put those things down. And the things that make me happy, what are they? Maybe it's chocolate, ice cream, whatever, whatever makes you happy. And the things is in the pediatric hospital, we know this. We've met these families, we've worked with them, we've shared all this, we have it all in their chart. But you have to think you're sending patients out into the community and they might not know your family, they might not know your child. And so having all of this written down in a way that you can provide it to them, they can read it, they can see it, and you can just be mom or dad or the caregiver and being there as a support and not spending all your time with a medical professional when we can give them this information. And then they can upload in your chart. So anyone that works with your young adult, they can know these things. And so our health passport, all this information is available on our external website. And I can get the link to Stephanie with that. And then we also have, just so you guys know, to kind of go in conjunction with the passport, is we have roadmaps for our patients and families to know what their progression into adult care is going to look like, and all the different skills that we want to kind of develop throughout that time. So that's kind of the base of our passport. I know we don't have a ton of people on here, but I'm happy to chat. Questions, do you guys think things are missing? As a caregiver, what would you find helpful? I mean, we're always looking to grow our documents and things, so we're happy to add anything that anyone feels would be of value, but I'm happy to answer any questions as well.
So I just wrote one down, Stephanie.
Yes, please.
So thank you. Thanks for sharing all that. You, on the additional questions, it's mentioned who can make medical decisions for me. Is that because I'm thinking about them being an adult, and if they're their own guardian, does that include a copy of like a healthcare proxy or?
Yeah, it would. We always encourage them to have their guardianship. If they have a guardian, great, we have that guardianship information. If they have a power of attorney, great, then we have that with it. And then we also think it's really important for just like, who do I want there making those decisions with me? Even if I am my own decision maker, who's that support person?
Right. That's great. That's great. And then there was another, so who to call if I'm in the hospital. I guess I don't really have a question on that one.
But that one's important too, because sometimes, if they're not feeling well, if something's happening or causing them to be altered or distracted, or maybe they're just, sensory things are getting out of control and we can't really focus in on what we're wanting them to say, having that person that we know that we can contact is sometimes really helpful, especially if they've been brought in by someone that isn't their caregiver.
No, those are really great. I will tell you, there isn't a, where do you go? Like there isn't an adult hospital for parents or for kiddos and individuals, young adults and older adults with intellectual and developmental disabilities, unfortunately. And as we know, many of the medical universities don't teach that in medical school either, but we are making a difference and a change here.
We're working on it.
Yes. And at the University of Kansas Medical Center, I have been working with Family Med to do that exact same thing. So the residents there can take on individuals with intellectual or developmental disabilities, because my son saw his pediatrician till he was 27 years old. And I found a resident and she's like, yes, I'd be able to. And then we were able to, through Kansas Lend, start working with Family Med to train and work with those resident doctors. So if you're hearing this and you are looking for an adult provider, you can look to family medicine at KU Medical Center. So at the health system.
And we're also working, we've identified a lot of the different big hospital systems where we have direct referral processes for our Children's Mercy patients to get in with appropriate providers. We have a screening and a referral process that we've established to make sure that patients are getting scheduled with providers that are comfortable and skilled in working with the IDD population. We don't obviously have enough providers, but we definitely have a process that we've established rather than just cold calling providers. So we have a process that they get screened and really scheduled with the right doctors, especially because for some of our really complex patients, they really need to be seen at a health center because they're seeing 5, 6, 7 different specialties. And so having primary care at that location helps. So we have made progress, but it's still such a big piece. And a big thing is just access and number of providers that we have in the area.
Absolutely. Absolutely. So, and, MaryAnne, what was I just thinking about? Like, I know when I've had in the past, I've reached out to Kathy Hunt there at Oral Health Kansas and said, do you have a list of providers throughout the state that are really good supporting kiddos with IDD? And you all keep those lists as well. So I
I've
would
also
encourage
been, I don't know if
families.
anywhere in anyone's wheelhouse, but we've also been advocating for the insurance payers to identify within their provider list, their providers that work with IDD. Some of them more willing to have the conversation than others, but especially those with Medicaid or with private insurance to be able to identify when people go to look up a provider, as they have, you know, geriatric or cardiology or asthma, you know, putting IDD as one of those topics so families can know.
Yeah, that's a really big thing too. Yes. Anytime we always suggest going and calling your insurance provider and saying, who's in my network in
Mhm.
local to where I live. So, well, I appreciate both of you for coming tonight. It's not a bad thing. You guys got all your great information out there, and contact information. If anybody is looking to contact Stephanie or MaryAnne in the future, feel free to reach out to me and I can connect you with either of them. They do such a great job. Both of them do such a great job advocating. MaryAnne does all of that work, but I know Stephanie puts in a lot of work getting conferences and resource fairs for her families at Children's Mercy and others around the Kansas City area to get information out to families as well. So um, it's hard when our children grow up to be adults. Believe it or not, in June, my son's going to be older than me. He's going to be 30, and I just don't know how that happens. But hey, whatever. But anyways, I want to thank you both for being here tonight and sharing information on these passports. I think once families start to use them and individuals start to use them, they'll realize, whoa, where have these been all our lives?
Mhm.
I know I could have used it too. So thank you both very much.
Absolutely.
Thank you for having us.
And we also have it available in Spanish if anyone needs it. So they're on the website.
Yeah, if you would share both of those, send me both of those links. I
Mhm.
will make sure that those get into the recording information as well. So thank
Absolutely.
you.
Mhm. Bye, guys.
Bye.